opinion for what I read in the German literature about your country, and it's so unfair. Our country is a beautiful country. It's I think it's safer to be here than it is in Chicago, where I'm originally from. And I'm saying is
Pakistan,
that it's just sad.
Pakistan
It's
is a very hospitable country, but the thing is, since I've been alive, in fact, we've suffered from a very bad rift.
yeah, it's and I said is that it's sad that so many countries are biased against you, including the Middle East. If you want to get a job in the Middle East and you only have Pakistani passport, you won't really get a very good deal, and they there's a lot of problems with it. I had very great problems when I was in Qatar and in Saudi Arabia of hiring any people with Pakistani nationality, unless you had another passport as well. And
The
this is
fact is
sad.
there's a huge biasness against Pakistanis in the Middle East as well. I know a lot of positions where it's just Indian dominated positions and Pakistanis get rejected based on their just passports.
That's exactly right. And where I was in the National Guard, they had a they had an edict I couldn't hire Pakistani medical technologists or physicians. However, in Qatar, I was able to hire senior technologists for the blood bank. Alhamdulillah. That was and but those people came from Dubai. Maybe it was because they
Assalamualaikum,
had
sir. It's an honor to have you here with us again this year. And you,
I'm ready whenever you are. I'll stop talking. You tell me when
Yeah,
I
we're
start. Yes, sir.
we're just going to start in a minute.
Okay. So thank you all for arranging this marvelous.
was I audible?
You can hear me fine, right? You see my
Yeah,
pic,
yeah.
my screen, and that's what's most important.
The audio
So
and video is perfect.
yeah, the Mac is very good. Macintosh is very good for this. That's why I prefer it, and it has a very good camera. Okay, so anyway, it's set and I thank you all for inviting me for the privilege of presenting on your behalf. And I hope someday we can meet. Maybe when my back is a little bit better, I'd like to make a trip up to Rawalpindi and see your campus.
Yeah,
Why not, sir? Just like last year, I would like to once again extend an invitation to you to visit our office,
Yes, I
medical
would very
study
much like.
office.
Give me a few more months because it's my I caught brucella in Egypt many years ago, and brucella is an organism that comes back and came back. It's been in my spine, so I had to do a lot of special antibiotics for it. It's much better, but it's still better for me to wait a little bit before I start doing a lot of travel. Okay?
Sir, sir, please do get well soon, sir. Sir, with your permission, we may start with the session now.
Okay. Whenever you're ready.
I warmly welcome everyone in this webinar. Assalamu alaikum to all our distinguished guests, esteemed fellow students. I am Fiza Mariam from Batch 51, part of a Medical Aid Society, and I would like to extend a very warm welcome to all of you on this World Blood Donors webinar. On behalf of Medical Aid Society, we would like to start this session by the recitation of a Holy Quran. For this, I would like to invite Haris Muhammad Taif for Tilawat.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. القارعة ما القارعة وما أدراك ما القارعة يوم يكون الناس كالفراش المبثوث وتكون الجبال كالعهن المنفوش فأما من ثقلت موازينه فهو في عيشة راضية وأما من خفت موازينه فأمه حاوية وما أدراك ما هي نار حامية صدق الله العظيم.
Jazakallah.
Jazakallah.
Now let's start the introduction to Medico's Aid Society. As you all know, the Medico's Aid Society is established in 1983. It is a student-based, non-profitable, welfare-based society of Rawalpindi Medical University. It is volunteer-hour organization dedicated to serving our community. Medico's Aid Society consists of total 5 sections, starting from the blood section. Blood section primarily focus on providing blood to thalassemia patients who require regular transfusions and to those facing emergencies. Number 2 is the finance section. Finance section offers vital financial support whenever necessary, ensuring the comprehensive aid to those in need. It is responsible for maintaining records, annual audits of all donation expenditures and assets. Number 3 is the medicine section. Medicine section provides free medical care to those who either don't have access to it or cannot afford. Medicine section also arranges free medical camps and hepatitis B vaccination camps. Number 4 is the publication section. Publication section highlights all activities of MAS through posters, videos, seminars, and webinars. Publication section raises awareness regarding important medical issues. The last one is the general section. General section conducts executive board meetings and maintains a healthy connection among the university students, administration, social welfare, and pathology department and society. Thank you.
Now, once again, welcome each and every one of you for joining us in this World Blood Donor Day 2024. And I'm Bisma Tahir, the sub-publication section in charge here at Medico's Aid Society. It is my distinct honor to introduce our esteemed guest speaker, Dr. Zaid Marinkov. He is a distinguished graduate of Northwestern University's Honors Medical Program, where he earned both his BS and MD degrees. He is also a board certified in anatomic and clinical pathology by the American Board of Pathology. He is a fellow of the College of American Pathologists and the American Society for Clinical Pathology. His impressive career includes serving as the division head of transfusion medicine and laboratory information systems at Hamad Medical Corporation in Doha, Qatar, and the Saudi National Guard Health Affairs in Riyadh. Additionally, he has also provided his expertise as a medical consultant and advisor for GPI MedInfo Hematos Blood Bank software in Nice, France, and Trento, Italy. Currently, Dr. Marinkov is an independent consultant specializing in transfusion medicine and blood bank information technology. I would request you all to please join me in welcoming Dr. Zaid Marinkov. Thank you for giving us your time and joining us today, Dr. Marinkov, and over to you.
Okay, assalamu alaikum. I wish to thank the organizers of this meeting for inviting me. It's always a pleasure when I have some work opportunities on consulting in your beautiful country, which is so misunderstood. But today we're going to talk about blood donors, and this is going to be different than my lecture last year because I want to extend it to talk about special types of donation that the public can help us with, which you desperately need here, as other places in the world need. So without further hesitation, I shall start. Okay, it's dedicated to both hospital, blood bank, and blood donor centers, and of course to the blood donors. Without their sacrifice, their donations, we could not keep our patients alive. Okay. So our topics today, a little different. We're going to talk about the regular donation process and clear up some misconceptions about the side effects of regular donations. Then we'll talk about special donations and how we use them to establish a rare donor registry, and talk a little bit more about apheresis donors. And I hope you will find that interesting. First, these are our lecture objectives. Is it safe for the donor to donate? Can he or she donate safely without medical risk? We don't want to put any donor at any risk. That's why we screen the donor very carefully to see if it's safe for him to donate. At the same time, even if it's safe for him, that blood that we collect has to be transfused to a patient. There is a risk of disease transmission from the donor to the patient. So we want to minimize that as much as possible. And then how do we handle special needs donation? That's today's lecture. So special collections are donors with special blood types. The red cell has over 300 antigens, 300 protein and carbohydrate markers, and not everyone has the same ones. And the ones that you don't have, if your blood is transfused to someone who doesn't have what you have, you can make antibodies against your type, and this could cause problems with transfusion. This is very common in patients who are frequently transfused, like sickle cell patients and thalassemia patients, cancer patients, anyone who's chronically transfused. Then we're going to talk special collections. Sometimes instead of whole blood, we're interested in collecting platelets, plasma, or sometimes just the red cells, not the whole blood. And we can do this with apheresis donations. And I'll explain that a little bit later. Now, for the audience, there's a few things you have to know, but I'm going to keep the technical information very limited. So the hemoglobin, which gives the red color to the red cells because of its iron, helps oxygen transfer from the outside, from the air through your lungs to the tissues. No oxygen, you die. In the plasma, the liquid part of the plasma, the liquid part of the blood, you have soluble coagulation factors that in case you cut a vessel or that, the blood vessel constricts and then they form a blood clot. There are many things else in that plasma, and we don't have a lot of time to talk about many of those other things. Platelets also help forming clot, but they're not just soluble factors, they're actually a cell type. And these facilitate the clotting of the blood. Then another part, which is not commonly done, is to collect the white cells to fight infection. And you can collect white cells to get stem cells, so you can do bone marrow and stem cell transplants. This is just a picture, not from here, but from my laboratory in Qatar, which uses an automated production system. But you can see that the red cells are relatively normal, slight difference in color. This is plasma. This plasma has been treated and has a yellow color. It's still under processing. It's not the final label, but it's been processed to reduce the risk of infectious disease. These are platelets, very nice platelets, which don't have any contaminating red cells. That was done on a machine. It's very difficult to do this manually to get that kind of quality. Most important thing is blood is a drug. And so it can only be dispensed by physicians. Anywhere in the world, they have this regulation. It has many different things in the blood. And as a physician, you'll be learning how you select the part of the blood you need for whatever your problem is. And so we talk about the red cell, the hemoglobin, the clotting factors, the platelets, and some other things that are in the plasma, like the immunoglobulins, which are actually antibodies and help prevent infections and increase your immunity. We check that the donor is feeling well. When you get sick, you start with some non-specific symptoms. You don't necessarily get a rash or have a definite diagnosis. You don't know. For the first few days, there's something called the prodrome. And in that period, the symptoms are non-specific. The most important thing, if you do not feel well the day you want to donate, delay it. Don't try to force the donation, because you might be coming down with the disease, which might make the donation unsafe for you, but it can also transmit disease to the patient. That's the most important thing. The most important thing we do to screen the blood is ask the donor, does he feel well? If no, do not donate. Now, for donation, you're going to lose up to 10% of your blood volume. So you should eat and drink. Do not smoke immediately before or after donating. If you do this, you increase your risk of fainting. If it's very hot outside, you should drink more fluid. If you have to wait outside to do a blood donation, in 10 minutes, you can lose, at these temperatures, 45, 50 or higher, you can lose a liter of fluids. And then we take out another half liter of blood, and then you don't have enough blood volume and you can faint. When you come, please give us information about your medical history. Have you had any diseases? Are you taking any medications? Where have you traveled? Have you ever received blood before? We will ask these, but think about that before you come to donate. Medication. This is one of the major reasons where you're deferred. Medications may affect how you respond to the blood loss of a donation. So we don't want you to have a problem with that. So we need to know all your medications. We check them. In addition to that, if you're taking some antibiotics for infection, you should not donate. If you have certain chronic medical conditions, you probably should not donate. And we'll be reviewing that, and we'll go to a physician for review at the time you come in. Vaccinations. Some vaccinations will prevent you from donating if you had them recently. Other ones do not. Donation intervals. What I'm showing you are donation intervals that are widely used internationally. I think the Punjab standards prefer you do it every 90 days, but many other countries do it every 8 weeks for whole blood. For apheresis, the donations are more frequent. And if you're donating blood or apheresis frequently, we may offer you iron pills to help you maintain your hemoglobin. If you donate too frequently, you could lose iron and you could become anemic. So our blood drawing area, there's our mascot, Fang, who's waiting for you to come in. Now, donation, there are many parts to the blood bank. One is the donor collection of blood. There's a processing of blood. And then another one is the actual hospital blood bank, which chooses the particular unit that you need for your patient, okay, for your situation, for the patient's situation. We register you. We check to see if you donated before, that you've waited the time interval, 56 days for whole blood, 2 days for apheresis. We have a detailed donor questionnaire that we ask. Our staff are trained to ask a specific questionnaire, and they're familiar with what the answers are. And there's always a physician available to review the results. We then take your blood pressure, pulse, respiratory rate, and we check your arms where we're going to donate. We want to find a good vein. If you don't have a good vein, you can't donate. Also, sometimes you could have an infection on your arm or scarring, and then you shouldn't, then this is a problem. We probably might not be able to take you as a donor. We also check to see if there's any signs of drug abuse, because people often inject themselves with drugs in their arms. So we're always looking at that. If you're taking drugs and injecting yourself intravenously, we don't want you as a donor. Collection. The actual collection takes anywhere from 5 to 15 minutes. And then we observe you for another 10, 15 minutes and offer you a beverage. And in some places, they offer you food. We want to make certain that you're fully recovered from the donation before we let you go home. If this process is well organized, we can complete everything from registration to the observation after donation in about 45 minutes for whole blood. Apheresis may take 90 to 120 minutes because it's a longer process. Registration. We positively identify you. We check if you have a donor deferral history, and we generate the labels and paperwork for donation. Then we have a private area where we ask you questions to see if it's safe for you to donate, or if it's safe for your blood, even if you can donate, is it safe for the patient to receive it? So we ask a lot of history questions. This is done private and confidential. No one else will hear your answers. Big blood pressure pulse, check your respiratory rate, check your temperature, inspect your skin, like I said. If you have any infections on your skin, we don't accept you for donation because sometimes the bacteria that cause the infection, that can go into the bloodstream and it can grow in the blood, and that could be very dangerous for a patient. So the two main types of donation are whole blood, usually 450. Now at Shalchat Chaim, where I'm doing some consulting, they use a 500 ml bag. But even 500, it's less than 10% of your blood volume. Apheresis can be for collecting some fragments of the blood, the platelets, the plasma, the red cells, or combinations there. Sometimes we get plasma and platelets. Sometimes we get only red cells. Sometimes we only get plasma. So there are different ways we can do that, depending on what the needs are. And then there's white cell apheresis, which we would be doing as part of a stem cell collection. Some places collect white cells, and they use them for patients who are infected, have bad infections, and they don't respond to drugs. But routinely, we don't do that. Whole blood collection. Whole blood collection is simple. You sit in a chair after you've been interviewed. And here in Saudi Arabia, I'm showing a picture. My staff are collecting blood from a captain in the Saudi National Guard. And they were using this for World Blood Donor Day in Saudi Arabia many years ago. But it's a very efficient process, 5 to 15 minutes to collect. Apheresis is a little different. Here we have a machine, and the machine collects portions of the blood. And this can take 60 to 90 minutes for donors. So apheresis donations is any of those elements, platelets, plasma, red cells. Normally, if you'd like to do this donation, we ask that you donate whole blood first to make certain that you can tolerate the whole blood donation. But sometimes patients with cancer, and we need their platelets, we may ask family members to donate platelets initially. So we have ways of handling that. And but most of the time, the apheresis donations from the machine are done after you've done a successful whole blood collection. The arm, the phlebotomy, the actual needle injection and collecting the blood, we wash your skin to kill the bacteria that live on the skin. We have a special needle which is designed to minimize pain, and then we do the collection. And I said 5 to 15, but usually 10 to 15 minutes for a whole blood collection, or up to 90 minutes for donor apheresis. When you're finished, depending on your blood donor center, you may sit in the chair and be given something to eat or drink, or in some places, they actually have a restaurant and they offer snacks and beverages, including coffee and tea. And at that time, like here in Australia, where these pictures are from, someone is actually setting up a donation appointment for you, for your next donation. Because blood, we do not pay for blood. We have only volunteer blood. And so we're always looking for donors. This is a very difficult weekend for the blood donation centers because with everyone going home for Eid, there are fewer donors to collect blood. And we still have great needs for blood during the holiday. So there can be shortages. So we're very, very interested that if you're around to try to donate during the Eid holiday, from now until next Wednesday, because we'll need blood, because on Thursday next week, a lot of places want to return to their normal operations, and they'll need blood for the surgeries and for the chemotherapy and other things. Now, when we collect the unit of blood, right now we know that it was safe for you to donate the blood. We do testing for certain infectious agents, and different countries have different rules. This is common than what you're doing here. Hepatitis B, hepatitis C, human immunodeficiency virus that causes AIDS, and malaria. We also ask you if you've traveled in areas where there are malaria, and we may, in some places, may do extra testing. Then when the blood is collected, we separate it, separate the whole blood into different fractions. And at the same time, we have to do some testing on your blood for the blood type and see if you have any antibodies in your blood. If you do, then probably we will not be able to accept you as a donor and we'll discard your component. Here is one busy site in Saudi Arabia where donations have come in and everyone is busy taking the whole blood in the front and extracting the parts in the back of the place. It can be a very hectic place, very, very busy. They can process in this type of space, hundreds of units per day. And have that all processed and finished by the next morning, so that blood can be used. Then there are machines for testing. These are some of the testing for the hepatitis viruses and for HIV. And these machines are very reliable. They're extremely sensitive, but they're extremely expensive. Probably this donor marker testing, this is the most expensive thing in the processing of the blood. And then we have to do the blood types. Since we can get hundreds and sometimes thousands of donors in one day, we have a machine that does the blood types. And this is an Ortho Vision Max, which unfortunately you're not using it in Pakistan. And maybe I will recommend that for my clients here. It's a very good machine. And I use this for more than 10 years in Saudi Arabia and in Qatar, and it's really fantastic. There are other good machines. What I'm saying is that we have to process hundreds of bloods in a very short time period. Now, safety of blood donation. The donor is screened to see it's safe for him. The donor area is clean between donors. You're not going to get disease as a donor. Everything we use is disposable, and it's not shared with the next donation. We clean up the area to eliminate the risk of infection. Sadly, blood is short-lived. We don't keep whole blood routinely, but it only has a 3-week lifespan. Most people in the country are using something called CPDA. One is that's where they collect their whole blood in, and it's only good for 5 weeks. Many places are switching to something that lasts 6 weeks. Platelets, 5 to 7 days at room temperature, of 2 weeks if they're refrigerated. Blood types. I don't have data from here, but actually I can tell you this European set of figures, your type B here is closer to 20%. AB is maybe 3%. And I think the O and AB are probably close to your numbers. You see that. So you can't give you cannot just take a blood and give it to every patient. It must be matched. There are certain blood types that must be matched. It's not important for you, the public, to know this, but it's very important for us in blood bank. So we have rules as to what types of blood each major blood group can have. And there's blood groups that's for the red cells. There's different rules for the plasma. And we have new components that we make, which we can use the plasma for everyone. And that typing machine, can do the special testing that allows us to do that. So these are things that we're going to be making from your blood in the near future. If you have a major trauma, a major accident, you may need a lot of blood. And we've been giving red cells and plasma and platelets and some other things in the plasma called cryoprecipitate. These things, we would give large numbers of components. But now we're learning that if we were to keep the blood as whole blood, and verify that it doesn't have a lot of antibodies, in that whole blood, there's plasma, platelets, and red cells. We can rapidly give several units of whole blood, and it's better than giving all these separate components. Another thing is there's always a shortage of AB plasma. We can use low titer anti-B A plasma for everyone, a universal blood type. And this makes it much better for trauma. Now we just come to some simple things that kill people. You know, in blood bank, people make mistakes, and the simple mistakes can have the most dire consequences. You have to make certain that you're identifying the patient properly and the donor. If a mistake is made and you give the wrong blood, you can kill someone. So at the time of collection, you have to bring a picture ID with a unique number on it, alphanumeric sequence, numbers and letters. Usually that's your identity number. And patients, they have an armband that's unique to them with a unique number, and we use that. So we have to double, triple, quadruple check that we drew the right patient. Number one cause of death is a lack of giving the right blood to the right patient. Here is a hospital transfusion service that has a lot of space, and they do the testing. We have to test that the blood that we're selecting is compatible and proper for your patient. There are many things that can go wrong. So even if you match these blood types, the ABO blood types, there can be other things that can go wrong. So there's other testing. So there's also something called RH, another blood group. This may have to be matched in some cases. We look for antibodies because these are another thing that can kill your patient. So chronically transfused patients, like sickle cells and thalassemias, we have to look for antibodies. And we always are checking for, we call incompatibilities, where there's a danger. I said red cell antibodies are made against antigens that you don't have, and there's over 300 of them. And so we are always looking to see if you have any life-threatening antibodies, because if you do, we have to select special blood. Examples, sickle cell patients, thalassemics, up to 50% make antibodies in so-called RH system, and they can make in other systems. So if you have an antibody, say against one of these antigens, we have to select blood that doesn't have that antigen. So it takes extra time. And the problem is your patients who have thalassemia and sickle cell, they just don't make one antibody. They often make multiple. Sometimes you have to screen thousands of red cell units to find the unit that's compatible for your patient. This can take a very, very long time. If your patient is bleeding, you can't wait. But if you don't match, they could die of a fatal reaction. So that's why we're going to talk about special donations, because if you've been a repeat blood donor, maybe we can do the special typing on your blood, and we'll have that stored in our computer system. And in the future, if we have a patient who has need of your special blood types in these other blood groups, we can ask you to come in and donate on behalf of the patient. I've had very good success with this in Qatar and in Saudi Arabia. And it's very important that we find donors who want to participate in this. Normally, we invite people to do this if they donated several times. It's very, very important. And I'm showing you our work. This is an example of a very complicated antibody. And to understand how to do this, my staff and my physicians have to learn how to read this. And you're seeing here about 25 blood group antigens. Some of the cells are positive for them, some are negative. We have the reactions that are occurring, and we interpret it. This is a very rare antibody combination. And for those of you who are blood bankers, this is an anti-JKA only reacting with a polyspecific antiserum, and only reacting, I think, at enzyme phase. So this is our need. If you have multiple antibodies, we could have to screen hundreds and hundreds of units. But if we've pre-screened you, because you're a repeat donor, we know your type, and then we can try to get the donors that match the type to come in and donate. This saves a lot of time. Also, we maintain large stocks of blood in the blood bank. And so maybe we have the types already in the blood bank so we can immediately use them. So aside from people who get chronic transfusions, cancer patients can have multiple antibodies. And cancer patients not only have problems with red cells, but they have problems with antibodies against the antigens or these substances on platelets and on organs. So we need the match. And if you're getting a bone marrow transplant or a kidney transplant or a liver transplant or a heart-lung transplant, they're going to check to see what your types are. Then they have to screen for donors that are compatible, just like we do for red cells. So we phenotype, that is, we determine the antigen typing of donors across many blood groups, put it in the computer system. The blood bank software will help us identify donors that match these types, and then we contact donors. In Doha, Qatar, when we had a very special need, we checked in the computer system because we had about 300,000 donors in our system. If we found a match, we then sent an SMS to that donor's phone and asked them to come and donate. So what we really need for the country, and this goes beyond any individual hospital, is to have these donors with this extra typings listed in a special registry where we know all their extra antigens. It's expensive to do this testing, but you only have to test the donors once. Once you've done that, the issue is to find the donors that match. And how you match and which antigens you match, that's something that's what I do and select. So you don't have to necessarily match everything, but it gets very complicated. So repeat blood donors, whole blood donors, we often invite them to participate. We do extra testing on them, and we know what's on their red cells, these other markers, and then we have that available for the patients. The same thing applies for platelets and other things, but the platelet situation has not been set up in Pakistan because there's other antigens or substances you have to match. But inshallah, someday they will have ways to check for platelet types. This is one that HLA is human lymphocyte antigens. These are on platelets, very, very important. And we would do this typing, which is extremely expensive, and have that in our computer system. And then if a patient is being treated with chemotherapy, we would be able to match the platelet types. It requires a large number of donors, thousands of donors to provide. Now, when we find your blood, we keep it stored and ready for use for up to 72 hours. And the unit has a reservation label so that no one takes it for another purpose. It's in the computer system that it's reserved, but there's also a label on the unit. Now, how do we do the transfusion? Doctor orders the blood. He orders which blood components, how much to give, how fast to transfuse it, and when to start it. When he orders those things, we find the right units. We then have them reserved. Someone from the ward or floor or the clinic comes to take the blood from the blood bank. They carry it to the patient's bedside. Two people then verify patient identity and check that we got the right unit for this patient. Now, there are computer systems, little portable computers, that can check this at the patient's bedside. Then you only need one person. But it's important that there is double checking that the right blood has been chosen. And the patient is monitored at the at the beginning, during, and the transfusion, because there is usually a nurse there. Now, from last year, I was asked a series of questions about blood donation. So let's go over the myths, misconceptions, misunderstandings. Demand is increasing. We need more blood donors, especially during the holidays. And with vacations coming up and that, fewer blood donors are available. Blood donation takes 45 minutes to 60 minutes and 90 minutes for apheresis. There's no risk of disease transmission since we clean everything thoroughly and we only use sterile disposable supplies. No one will ever share a needle with another donor. Blood donation is minimally painful because we use experienced personnel who are specially trained, and there are special needles to minimize the risk of pain. Blood donation only takes a small amount of your blood, and in about 3 to 4 weeks, you will make up the blood that you gave up, if it's a whole blood, and even faster if it's platelets or plasma. And after drinking fluid to replace what you lost, you can probably return to your normal activities, but you shouldn't smoke. You smoke several hours after donation, you may faint. Let's see what's next. So, in summary, blood donation is a complicated process to ensure that the blood donor is safe and it's safe for the patient. Requires a dedicated team of blood bank personnel in the donor center and in the hospital blood bank or transfusion service. There are multiple checks. We check, we double check, we triple check, we do the blood types multiple times. We want to ensure that the right blood goes into the right patient. Nothing can happen unless you donate. It's simple and safe, one of the best sadaqahs that you can give your fellow man. And please, if you're around the area, come and donate. The blood donor centers will be very happy to have you. And in this next 5 days of holiday, it can get the blood supply can get very low. So the patients are still in the hospital. The sick patients are still there. They're still using the blood. You still have car accidents and other traumas. They're still going to need blood. So just because you're on vacation doesn't mean the blood bank's on vacation. Actually, for the blood bank, this is the most difficult time and probably the busiest time. So please respect the blood bank staff and physicians. They are under a lot of stress trying to get things for you. Don't waste blood. We train physicians and nurses on how to do these procedures and how to select blood. And forget about that, don't do this. There was a slide, a cartoon, I took it out. I want to thank the Rawalpindi Medical University and the medical students, the Medicos Aid Society, blood bankers all the world, my teachers and mentors who taught me this many decades ago, and you as a public who express interest in this. And we hope we can encourage you to donate, especially during holiday periods. Please, if you're around and you haven't donated blood in the last 8 weeks, come and be screened. If you can donate, this will help us greatly. And so I conclude with a picture of where I live now in Mauritius, sunset in winter, which it is now winter in Mauritius, but it's not very cold. I hope that this has helped you to understand the process of blood and why we'd like to invite repeat donors to become special donors and help us in in your need for the thalassemics and sickle cells and cancer patients by having extra testing done for free. You're not going to pay for any of it, but also that you make yourself available, if possible, to come in and donate for these special conditions. That's the end of my presentation, and now it's open to question. Again, I thank the organizers for inviting me to do this. I hope you understood what I said. Unfortunately, I speak a mixture of different types of English, and even my staff for the first few months I was been consulting here, they had trouble understanding me. So I hope you do a better job. Please take care. Please donate. Think about the holiday. One of the best gifts you can give for the holiday is to donate blood. Thank you. Assalamu alaikum.
Thank you so much, sir. The session was wonderfully conducted. I understood everything, and I personally enjoyed the session a lot. So, moving on towards the question answer session, we have collected a bunch of questions from the participants as the session was going on. I'll start asking those questions.
Please start.
Okay, so the first question was asked by Mohammed Mahfouz. He was asking you about the gap of apheresis donations. If you could elaborate more on that.
What I'm saying is that with apheresis donations, we don't take out everything. We only take a fraction of the blood. So you can donate apheresis more frequently and up to 24 times a year. If you use the international regulations of donating every 8 weeks for red cells, you can only do in 1 year 6 to 7 donations. With apheresis, you can donate up to 24 times. Platelets or plasma or the red cells from the apheresis machine. Okay, but whole blood, you're limited. So it's less, 6 to 7 times a year, whole blood maximum. And I don't think most people donate that frequently, but with apheresis, more often. For supportive cancer patients, often some of the donors are doing 2 donations a week to maintain giving platelets for patients taking chemotherapy, because in the treatment, their platelet counts get very, very low. And so they need a lot of platelets. We make platelets from whole blood, but we also collect apheresis platelets. I hope that answers his question.
Yeah, okay. So the next question I'm going to ask is that, is it necessary to match platelets as well when only platelets are being transfused?
Well, platelets have different substances or antigens in the surface, and sometimes you have to match. If a person is getting multiple platelet transfusions, they can make antibodies against platelet antigens or tissue antigens. And then if that happens, then they don't get the proper response to the platelets. The platelets are destroyed rather than being available to provide for the blood clotting. And in those times, we would have to do some special antigen typing. This is very, very, very expensive. Most places in the country don't do this, because it can cost, to do the testing, initially might cost $1,000 or more. So not many places are doing platelet antigen typing. What we usually do is if someone is getting platelets and then they don't respond as well, we look at family members and we try different family members and try to find which one gives the highest number of platelets after the transfusion. And that's how we deal with it. And it's very effective. That's a very effective way. So we don't have to spend thousands of dollars on typing donors, thousands of dollars on typing the patient. And this often works very well.
Okay, thank you so much. And so the next question is that if someone faints after blood donation, what is the protocol for recovery in such cases?
Okay, if a person faints, that means his blood pressure went down. That means he somehow stimulated a particular nerve and it told the heart to lower the heart rate. So you don't get as much blood going to the brain. So you put that person flat and then they recover because the blood supply to the brain comes back. So they don't remain unconscious. So we lie them flat. We also offer them fluid. We make certain that their blood pressure does come back, and we take that several times. We will hold a donor who faints for extra time because we don't want him to get up and faint. You don't want him to leave the blood bank and then faint when he's driving his car. So we will watch him and make certain that he's stable for his sake before we let him go home.
Okay, so when we ask the donor to lie down after giving donations, how long is it necessary, absolutely necessary for the donor to keep lying down just to be safe?
Well, the donor is sort of reclined. So I would say anywhere from 5 to 15 minutes, and it varies by donor. Some donors need more time because when you give the blood, you reduce the amount of blood in your system. Your body responds by 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 increasing the heart rate so that there's enough blood flow stays. And we give you fluid to try to replace some of the fluid lost from the blood donation. So I'd say a normal person, and we've done all the screening, will be ready to leave within 10 to 15 minutes.
Okay, so the next question is by Fiza Ali, and she asked, if blood has been screened and groups are matched, can there still be any contraindication for transfusion?
What I'm saying is that if blood has been screened for infectious disease markers, we can't detect everything. We detect most of it, but there are still organisms that can be transmitted by blood transfusion, some of which we don't test because there are so many possibilities. We test the major diseases that are associated, infectious diseases associated with blood transfusion. But there are others. There are minor things. Example, dengue. Dengue, there's no good test. Patient has dengue, they shouldn't be donating at all. But if they were just coming down with dengue the first couple of days, they may not have symptoms, but the virus is in their system and that could go to the patient. So there still is a slight risk. In addition, we do these antigen typings to know what's on the surface of the red cells or platelets, whatever. And there are many, many, many antigens. We test 30, which are the ones that are usually associated with reactions. But there are others, rare, extremely rare. It's been said in the United States that if everything is done right for this, looking for these antigens, there still is about a 1 in 40,000 chance that there could be a reaction. But those reactions can be easily taken care of. But we don't want the patient to get a reaction.
Okay, so I wanted to ask personally that after any viral infection, how long should a person stay away from donating blood just to be safe?
This depends on the virus. There is no single number. Okay? Some infections, you have hepatitis B or C or HIV, you should never donate again. Influenza, probably 1 month is adequate. Dengue, it's probably 1 month. There are other infections. For example, brucella from milk that has not been heat treated, that probably you should never donate. So there are different rules for different things. It all depends. So you have some common things. No. Another thing is if you had a bacterial infection and you took antibiotics, you should probably wait at least 1 month because those antibiotics are still in the blood, in the plasma from the blood donation. And if you give that to a patient, that can also react to the patient. Some patients have allergies like penicillin. Give them a penicillin from a blood transfusion that can cause serious reactions. So it depends on the medicine, depends on the virus. There's no simple thing. So our staff have lists and the rules for this. And so it's very complicated, but we have the major categories defined. So we rarely have disease transmission from the blood.
Okay, so another question we have by Ali is, some people often circulate messages regarding blood donations about for 20 blood bags. Is there a medical condition which requires such a large amount of blood?
What we can only take 1 unit or 400 or 500 mLs at one time per day. We won't take more than that at one day. So I don't know, what were they, repeat the question again to me? I don't think I fully understood it.
Okay, so the question was that there are often messages asking for blood donations as large as about 20 blood bags that a patient
I
requires
never
this.
know, 20 blood banks at one time, no. There's, 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 well, you can't get that from one person. If you needed 20 at one time, that patient's massively hemorrhaging, and you need 20 donors. Okay, there's no reason, there's no way you can collect 20 units easily, and it's got to be from a large number of donors. So if someone's asking for you to donate 20 units, you can't do it. If you did that, you exsanguinate, you take all the blood out of your body and you die.
No, sir. Let me rephrase the question. The question is basically that sometimes an attendant of the patient or the patient themselves may ask us that for 20 blood donations for 20 different donors. Are there any diseases that require 20 or more than 20 donations or more than 20 blood
Guys,
bags?
well, it depends on the patient's condition. If he has antibodies, you might have to look for, I mean, I could tell you in the hospital just this week, there was one where you needed to look for 500 donors to find one unit that was compatible for the patient who had been multiply transfused. But you wouldn't be collecting the 500, you'd be screening among the 500. And if you had this rare donor registry, you'd have that already done. You'd have your donors defined. Sometimes there are antigens, there are combinations that you have to screen large numbers of people. Example, family member has a rare antibody. He's missing something that most people have. We call that antibody to a high incidence or prevalence antigen. So we look among the family members. We may have to screen a large number of family members because that's where we're going to find blood that probably matches the patient. But it takes a lot of time to do that. So there's lots of antigens, and there are antigens we don't know about. And we have approaches to handle this, but it can take several days to try to find blood. And in some parts of the world, as you're looking for blood, you may go to what's called a rare donor registry internationally, and they may have the blood type that you're looking for, these special bloods. And then they would ship that to you at your site. This is very, very expensive, costs thousands of dollars. And usually those bloods are frozen, then you have to thaw them and other things. It gets very, very expensive. So I'd say, practically speaking, we don't bring blood from the outside. We look for family members. But there, a patient's not going to need 20 units of blood at one time. You may have to screen 20 units to find the blood you need. And we can calculate how many donors we have to check to do it. And we make special arrangements. We will ask the family to bring the family donors. We'll try to facilitate it. We'll have special people to do the screening for it. And if they pass the screening, we do other testing. We do the regular testing, marker testing, and other things. And then we can collect the blood. But it's not something we can do in an hour. This is done over days. So it's very important when the patient's in the hospital that the doctor checks to see if there are antibodies. And the sooner he does that when the patient's admitted, if we find he has a rare antibody, that patient, we can start this screening process. But if you didn't do that, and then the patient has an emergency need, and we haven't found any blood, we might not have any blood for that patient. And they give blood that's not tested, can be done, but it could be fatal. So the key thing is plan in advance and look, see the situation, and react to it. And this can take a lot of time. It can be very expensive too, but it can be done.
Okay, so another question we have is what are the potential benefits of blood donation for the donor themselves, except for helping people?
I'm saying that the donor is stimulated because he's lost the blood volume. There are many hormones and other substances in the body which are stimulated by the blood loss. and he restores his blood volume. Some of that action may be beneficial to the donor. We don't fully understand that well, but by donating regularly, you're stimulating your hematology system in your body, your hematopoiesis, to respond to the stress. And you could sort of condition it to do it. And we often, so it probably does help the donor to do this, but it's not well understood.
Okay, so Hajra Shabir is asking about the time period between two consecutive blood donations.
If it's whole blood, which is the common type, some places use 8 weeks, 56 days. Officially, the Punjab blood standards is 90 days, 3 months. But I know there are blood centers in the country which do it every 8 weeks. So that means, there's only a limited number of whole blood donations, but pheresis donations 24 times per year, maximum. Now, if you donate a large number of times, even on pheresis, you lose a little bit of red cells. So we may be checking your blood count, and we may offer you iron pills to help restore the iron that's lost during the process of donation. So we'll be watching that too. And if you were to come to the blood bank now, you'll receive an information pamphlet which says minimizing iron loss from donation.
Okay, Mariam Sayal is asking, how often can an individual donate blood safely, and what is the eligibility criteria for donating blood?
The criteria differ between men and women. Women are only allowed to donate whole blood or red cells. Males can donate whole blood, but they can also donate platelets and plasma. We can't do that for red cells. And again, the rule, every 56 days for whole blood or red cells, or up to twice a week for the pheresis donations. But
Okay,
you can
so-
only do that if your hemoglobin is at a certain value. If you have low hemoglobin, you're iron deficient, we will not let you donate. It's not safe.
Okay, so another question by Ali is, do we become obese or weak by donating blood?
No, there's no hormonal release or something with the leptins and the other factors that cause obesity. No, it has no relation to that. Sometimes people who are involved in pheresis and things are given steroids. That's a special drug that can cause weight gain. But the actual physical donation of blood, there's nothing in there to cause a weight gain.
Okay, so there is another question by Ali again. He's asking that he suffered through typhoid a year ago, and now can he donate blood now
He did what? He suffered for what?
from typhoid?
Typhoid? Well, this varies by country. Some countries have donations restrictions for 1 year or 2 years. I actually have to look and see what the Punjabi standards say. I think it's at least for 1 year. It might be 2 years. So we'd have to check. Some places don't use those standards, and they may have different criteria. Some countries, if you've had typhoid, they won't let you donate at all again. Which is correct? Which is safest? These are different preferences, and really no one knows. But typhoid has to be fully gone, and you probably would, if I were having a patient come with that, I would want to check some tests and to verify that he's fully recovered from typhoid before I would consider. So I might order some extra tests to check that at the time he comes for donation. But that's my personal preference as a physician. It's not a requirement from the blood bank standards.
Okay, so another question is, what is the difference between FFPS platelets and mega unit WBC, Are all these terms the same thing?
No, actually, the word mega unit is not accepted outside Pakistan. That's an apheresis donation. You see, the one way, when you take a whole blood unit, you can collect a small unit of platelets, which we call a random donor platelet. When you do pheresis, you usually get 6 times that number in the pheresis. So one of these random units from whole blood is not enough for an adult. You have to have 4 to 6 of them. And so the apheresis one collection is enough for an adult patient. I guess here in the country they use mega dose, but this is not accepted terminology. So I just call it apheresis concentrate. And that's enough for an adult. If you have a child and you want to give from the apheresis, we can split the unit and measure out a particular amount for a child based on his size and his weight. That's about platelets. Fresh frozen plasma is just plasma. It does not have platelets. This is used for treating coagulopathies, often with trauma. Then if you store it frozen, then you thaw it, and then you try to use it within 24 hours. But if you don't use it in 24 hours, we can change it to another blood component that's good for 5 days. And that's useful for trauma situations. That's FFP. There's cryoprecipitate, which is a part of the plasma, which has certain coagulation factors in it, and we can collect that separately. So it all depends what you want to do. With pheresis, you're more selective. You don't make everything. You only make what you need.
Okay, so another question asked by Fadia is, what is post-donation hematoma and how can we avoid this?
Okay. Unfortunately, sometimes despite very good training, you might damage the vein which you collected the blood from. So afterwards, after you take the needle out, blood may continue to flow and it goes into the tissue and you get a little bit of a bulge and you have blood in the surrounding tissues. That is a hematoma. Hematoma is a mass of blood that's in the tissue. What should be done is when you take the needle out, you have to hold the vein carefully for several minutes to minimize that risk. But sometimes it happens. If it happens, we have special bandages to stop the bleeding. We keep that on tell you to keep that on the arm for a few days. Then we come back and check you to see if there's no other injuries at that site. So this is an unfortunate complication, but it's not common. I think in time I've been consulting for Shabka Khanim that I've only seen one big hematoma. But it is a complication, and less experienced personnel are more likely to have it. But even a really good phlebotomist, sometimes it happens. So it's not life-threatening. It'll be ugly. It'll look purple and green and blue, but it'll go over the discoloration and the bulge will go away over several weeks.
Okay, the next question we have is by Hanan. He's asking that, is there a process in which a person can donate blood in order to be used in emergencies by the donor himself?
Yes, there's something called autologous transfusion. And one type of autologous, auto means self. Okay, so if you have a trauma, you're injured, like in a car accident or something, and you're bleeding, there are special devices that collect the blood that collects in the tissues, like in the belly. They take that blood out, they may wash it, they may not, and they retransfuse it in you. So you use your own blood. For some procedures, if you have a rare blood type, you might donate a unit in a blood bag, and then we transfuse that during the procedure that you need. That's another type of autologous. Then there's other ones where we take out blood before you go to surgery, and then they do the procedure, and then they return the blood that they took out. It's called perioperative. And there's a fourth type. if you're getting a hip joint or a knee, or sometime you have certain chest trauma or heart surgery, there is blood that collects in these areas. We can put a tube in there and collect that blood and then re-infuse it safely into the patient. So there's 4 ways that you can get blood for yourself.
Okay, so Hanan asks another question that are WBCs matched before transfusion as well?
No, well, we don't routinely collect white cells for transfusion. Actually, if they do, it's the granulocyte fragment of white cells, and they use that for patients who don't respond to antibiotics, but it's not commonly done. And in my practice, I've never had to do it, but it can be done. But we collect white cells for another thing. Sometimes we need to collect stem cells in treatment for cancer. Certain cancers, in the white cells are cells which can repopulate the marrow. And when they give the chemotherapy, they can destroy the marrow or from radiation. Then after they destroy the tumor, then we can repopulate the marrow with their own cells. That's called an autologous stem cell transplant. In other situations, if the marrow gets destroyed so they can't make blood anymore, we can collect from donors who are specially selected and typed and give those. And that's another type of stem cell transplant called allogeneic stem cell transplant. Okay, so there are different ways to do this. You can also take the donor into the operating room and collect blood by going into the bones where the blood is made in the bones. And so you can collect blood from those bones where the blood is normally found, and then we can treat it and concentrate the cells that are going to be used to repopulate the marrow. So there's several ways we can do that. So the only white cells we use for transfusion, say at Shalchat Chaim, are the stem cells or the bone marrow that we collect for cancer treatment. But that's not routinely done. It's only done for patients with certain tumors. It's not routinely done. And it can't be done at has to be done at a place which has the special equipment to collect the white cells and then to process them and freeze them for future use. So it can't be done in most hospitals.
Okay, I think that question concludes our question and answer session. We have answered all the questions asked throughout the session.
Okay, I
Okay.
thank everyone for listening. If you have any questions, I think you can write to your society. They can write to your society, and your society can forward me the questions, and I'd be glad to answer. So if you think of something else you have a question for, you can tell
Sorry. Excuse me, Dr. Marenkov, I'm sorry I'm interrupting. We just got another last minute question.
Okay.
And the question is, how can we convince our parents, especially as students, to let us donate blood?
Repeat, how do I convince whom?
Like, as we're medical students, how do we convince our parents to donate blood? To let us donate blood?
Well, you have to be the legal age in different countries. Some countries make you wait to age 18. Some countries let you donate at 16 if you get your parents to countersign it, because you're not considered an adult till 18. Some countries you're an adult at 16. So first is the age problem, and many countries and states in the United States have enacted special laws that permit people under 18 to donate. And it's very popular. We use sometimes secondary students at age 16, and they're adults functionally. It's just that it has to be specially allowed. So most medical students are probably over 18. I think 18 is the age that you use in Pakistan. So it theoretically could, but you have to make certain as a doctor or a medical student that you check for the screening if you're not feeling well or taking antibiotics or vaccinations. You check with the blood donor center to see if you're a suitable donor. Okay, and then it can be done. So it has to be, I think accepting younger people for donation is fine. At the other end, there is no upper age limit for donation in most countries. In Australia, the oldest is 70 for blood donors, but in some country, they've used patients well into the 80s and had no problem. So there's a lot of differences. A lot of the things in making donor criteria are legal. They're not necessarily medical, and they don't necessarily always have basis in medical fact, but they're there. And if it's a law that says you can't do it, then you don't do it without special permission. But I think medical students can donate. We've had blood drives among medical students when I was a student, and it worked out well. You can even have secondary students, but it depends what the legal requirements. If they're under 18, I don't know what you have to do in Pakistan or if you can allow them to donate. I don't know the rules.
Okay, I think with that question, we can conclude our question and answer session as well as the entire session.
Okay, thank you for inviting me. I thank people for listening to me. I hope I have at least made some people think about donating over this holiday weekend. It's very, very important. This is a special time. Your blood donation will be especially appreciated now during the Eid holidays. And so please consider it if it's possible, okay? And I wish everyone a good evening. Eid Mubarak, Kulu Aman wa antum bikhair, as we say in Arabic. And please take care of yourself, and Allah Kareem, okay? Thank you for having me, and good luck.
Thank you.
Thank you so much, sir, for joining our session and being a part of this session. It was an extremely informative session, and I'm pretty sure everyone got to learn something and take a message back home.
Okay, so please have a restful evening, a blessed Eid with your family and friends. But think of those people in the hospital who are unfortunate and they need blood. And it's going to be very hard in many places to have the blood available. So think if you can do something for them. Okay? Thank you and have a good evening. Okay? Assalamu alaikum, everyone.
Wa alaikum assalam.
Thank you so much.
Okay, it's a pleasure. And
Thank
I
you so much,
said
sir, for
for
your time.
medical students, if you'd like to have some sessions on some blood bank topics, we could arrange that. We could have lectures that you need, at least the lecture. I hope you all know how to hang blood, because you're going to have to do that as a junior doctor. And number two, that you know how to read that the right blood is being given to your patient or to yourself. Although you, alhamdulillah, may never receive a blood donation, a blood transfusion, I'm certain someone in your family is going to, and it's very important that you check and double check, because mistakes can occur, and mistakes occur all the time. So be vigilant, learn how to hang blood, how to write an order for blood. I see many orders from junior doctors. They don't know what they're doing. They haven't been properly trained. And it's very simple. Half-hour session, you'll be fine. And there's other topics we can talk about if you're interested. So just let me know. I'd be glad to try to do that. Okay. In August, I may be going